Hey everyone, this is Dr. Tom Sellers from Sellers Sports Medicine and Family Practice. I have a very interesting case for you today. It's about calcific tendinopathy, or calcium deposits in particularly a rotator cuff tendon of the shoulder. Calcific tendinopathy happens for many reasons, and some of which is poorly understood. Usually the reasons that calcium deposits happen or develop in shoulders are overuse, trauma, and injury. No matter the cause, once that calcium is formed in that tendon, it can cause a lot of different symptoms. The biggest being inflammation in that area, pain, limited range of motion. These are all possibilities. In this particular case, this patient has a calcium deposit or calcific tendinopathy of the infraspinatus, one of the rotator cuff tendons. Let's go over some anatomy and static ultrasound pictures. So, in the middle of the screen, we see a bright white substance in the middle of the tendon. That's actually the calcium deposit. It appears bright white because the density has changed, and it also kind of makes sense. Down deeper, you see the humerus bone, and that appears bright white because of the density. That's very similar looking echo texture, or the way it looks on the ultrasound. Now we see that we're taking some pictures, looking at the dimensions of this calcium deposit. We see that it's about 9.6 by 23.9 millimeters. And so that's a pretty sizable calcium deposit, about a 1 by 2.5 centimeter deposit. Now let's go over an actual video of the procedure. So first we're going to do a little bit of percutaneous tenotomy, or multiple needle passes through that calcium deposit. That will hopefully break up that calcium deposit, stimulate blood flow, and ultimately we will be putting blood product PRP into that region. You can see that we're kind of walking up that structure in terms of getting each area of that calcium deposit and doing multiple needle passes. We're starting with the deeper or the inferior parts of that, and we're going up into the superior or far-reaching parts of that calcium deposit. Now we see that we are actually injecting platelet-rich plasma, or PRP, into this calcium deposit, which is within that infraspinatus tendon. We see that there is a good flow of medication. And personally, when I was doing this procedure, there was a fairly low pressure on the plunger, which usually means that there's some occult tearing or small tears within that. And that tendon can actually, that defect can actually affect the bursa. So at the end of this video, we see that the bursal, the subdeltoid bursal dissension, and that's where that PRP is also going into some of those regions, which is great for the patient. After procedures like this, we have a good microenvironment. We've done multiple needle passes, and a few weeks later, we start doing extracorporeal shockwave therapy. I'll have videos about that in the near future, but that can also further increase blood flow, desensitize the region, and break up those calcium deposits. So we do both of those therapies for our patients with calcific tendinopathy. I hope you guys learned a little bit more about this issue and this particular injection. Thanks.